I'm Rachel Richardson. I'm the Method Support Unit Manager at Cochrane. And my role in this presentation is to talk about the methodological background to the changes in RevMan Web. Okay, so first of all, I'd like to acknowledge up front that the content that I'm presenting today is based on work done by Sue Brennan and team, who've worked on the InSync guidance. And it's also based on the handbook, the Cochrane handbook, particularly chapters 2 and 3. So these are really good places to go for more information about these methodological issues. Okay, so I'm very, very briefly just going to talk about how to start your review. And again, I assume that this will be very familiar to Cochrane authors already. So I'll just take a couple of seconds on this one. So your first step when you begin a Cochrane systematic review is to specify your PICO in advance. And as hopefully people will know, your PICO relates to your population, your interventions, your comparators and outcomes. And defining your PICO gives us the title and the main objective of your review. To put that in more simple terms, what you're doing first of all is you're telling us what you want to know. So you're telling us why you want to do this review, what you want to find out. There's some more information in the handbook really that advises you about things to think about when you're beginning a review and when you're formulating your review question. So you should think and you should make sure that your review is feasible. So you need to think about the resources that you have to do the review. You need to think about how big the evidence base is likely to be, how many studies you're likely to include in your review and whether that's feasible. You don't want to ask a question that you can't realistically answer because it's too big. And also you don't really want to ask a question that's impossible to answer because there is no existing evidence. Your question should be interesting. I think primarily interesting to you as review authors is important. Doing a review is a big undertaking. So you do need to find the question interesting to have the motivation to carry on and actually complete your review. It should be novel. Is there an evidence gap? You don't really want to be duplicating work that's been done already to answer this question, and think about why you need to do a new systematic review on this topic. You should think about ethics as well when you're framing your question. There's an opportunity cost when you're carrying out a review. There's other work that you could be doing in that time. And you also need to think about equity when you're answering questions. You need to think about questions that might be important for underserved populations. And finally, relevance. You need to make sure that your question is relevant. Is it important to stakeholders? Do decision makers really need to know the answer to this question? And it's also important to write up your findings in a way that's accessible to stakeholders so that you can maximize the relevance of what you've done. Okay, so I'm taking an example about exercise and osteoarthritis. So this is just an example of how you might start when you're thinking about beginning a review. You might have a very vague question in your head about, you've heard that keeping active might help people who have osteoarthritis. Is this true? And what are the benefits that we think that keeping active might have? Okay, so I'm skipping ahead a little bit. So this is how you may well have narrowed down your very broad thought, and you've narrowed it down into your review question, to your main review question. So what you want to know is, for people with osteoarthritis of the knee, what is the effect of exercise compared to no exercise on pain, physical and psychosocial function and quality of life? So as you can see, you've identified the main PICO for your review, your population, your interventions, your comparators and your outcomes, and you've formulated your overall review question. And I just want to give a quick plug for a web clinic that's being held next week. The Methods Support Unit are running a web clinic on considering scope at the review planning stage. And my colleague Leslie Choi from our team will be talking a bit more about developing your scope before you start your review, which will expand on the kinds of things I've just been talking about. And there's a QR code you can click on, which will take you to the link to sign up for the session. Okay, so here is where it gets a little bit more detailed and involved. And this is the kind of thinking that was introduced in the new handbook, the handbook that was published in 2019. It's not particularly kind of what kind of out there kind of methodology. And it's really just trying to formulate, I guess, what experienced review authors will tend to do anyway. But we've made it much more explicit in the handbook, which will hopefully kind of help review authors as they kind of drill down and get more detailed into the type of questions that they want to ask. So the next step is to think about your syntheses that you're planning in your review. And by synthesis, I'm not just talking about a meta-analysis, although I know traditionally that's the kind of synthesis that we do in Cochrane reviews, but I'm also thinking about syntheses where perhaps we can't meta-analyze data, and we need to use what we call SWIM methodology, which is synthesis without meta-analysis. So when you're pulling together the data, but not in a meta-analysis. Okay, so synthesis can be either of those two kinds of things. So an easier way of kind of putting that is that we want you to tell us how you're going to break your question down to answer the broad question. So you need to think about the components of your question when you're planning the syntheses that you'll be carrying out as part of your review. Okay, and when you're thinking about breaking it down, again, you're considering those PICO elements, but you're considering the PICO elements for your synthesis. So you're considering your population. You're also considering your intervention. So going back to our osteoarthritis example, some of the interventions we might want to think about are cycling, yoga, Tai Chi, or maybe swimming. We're thinking about outcomes. So again, the outcomes that you might want to think about are perhaps reducing use of painkillers. You might want to think about mobility, people's mobility, how that's affected. You might want to think about mental health outcomes. Does exercise improve people's mental health? And finally, you might want to think about quality of life outcomes. For example, EQ5D is a quality of life measure. So when you've thought about how you're going to break your question down, you'll start to get broad questions that you want to answer in each synthesis. So you might want to think about what's the effect of exercise versus no exercise on pain. So there you're specifying which outcome you're specifically examining in a synthesis. Question 2 gives you another type of outcome that you might want to focus on, which is physical function. So as you can see, we're breaking down the very broad review question into slightly narrower questions that are going to form the basis of our syntheses. I've got some more examples of kinds of broader groupings from different types of reviews. So first example about exercise versus no exercise, that might be relevant to your osteoarthritis review. Another review that I'm working on is looking at mental health first aid training. And you might want to be more specific with that and think about what's the impact of mental health first aid training on mental well-being. That's breaking down a broader review question. And our third example is perhaps slightly controversial, but again, a broad synthesis question might relate to what are the effects of medical or surgical masks versus no masks on the prevention of all viral illnesses. Okay, you also, once you've gone broad, you might want to get even more focused and have narrower groupings for your syntheses that you want to put together. So if you look at question 1.1 and question 1.2, you can see that we've further split down that exercise intervention into different types of exercise. So you might want to think about aerobic exercise, and you might also want to look at non-aerobic exercise and consider those two questions separately. And that might be important, to answer the questions that are important to stakeholders, and those may be logical groupings. So again, we're breaking down your initial big review question into smaller questions and thinking about what the peak over those smaller questions might be. So going back to the examples in the previous slide, your narrower groupings might look like this. So you might want to look at exercise versus no exercise its outcome on pain, and its influence on pain. And you might want to restrict it to just looking at people over 75. Looking at mental health first aid again, you might want to look at anxiety specifically as a mental health outcome. And you might want to specifically look at, does mental health first aid reduce anxiety when it's delivered in education settings? So when it's delivered in schools or universities or colleges. And going back to the masks example, you might want to look at masks versus no masks, but you might want to focus in on the outcome, which is prevention of influenza. So you're sort of keeping your fairly broad categories of intervention and comparison, but you're looking at a very narrow outcome, which is just influenza as opposed to all viral illnesses. One thing that's key, and one thing that's perhaps not always as well done as it could be in Cochrane reviews, is you need to think about your time points as well. What time points are you measuring your outcomes at? And you need to think about that in advance. You've got various options, and the time points that you go for, they'll be guided by what questions are important to decision makers. So, for example, do you want to just measure outcomes at the longest follow-up in all the studies that you include? The danger there is, of course, that you might get some heterogeneity between the different time points. You might want to measure the outcomes at the end of the intervention. So you might want to ask, how does exercise affect outcomes immediately after the intervention has taken place? So immediately after the yoga program, for example, how is people's mobility? You might want to look longer term, 6 months, 1 year, 2 years after randomization or after the intervention. And what you also need to think about is what if you've got multiple time points within one window? So, for example, you say that you're going to measure the outcome at 2 years. You say you're going to measure it at 1 year and at 2 years. But what do you then do if a particular study measures the outcome at, say, 18 months as well as 2 years? Which outcome measure are you going to use for your 2-year time point? So I think, those are things that are often perhaps not considered up front, but which are important. And planning your time points will, again, help you plan your syntheses. Okay, my final slide on methodology is just to kind of really run through, the advantages, I guess, of taking this approach and planning your syntheses in advance. So what planning your syntheses in advance achieves, it'll prevent ad hoc decision making after you've completed your searches. So you won't, have a broad question, do all your searches, see what you've got, and then decide what syntheses you're doing, because that's really not what we'd like to encourage. That's really not a particularly scientific method of carrying out a review. You need to decide what you're going to do and what questions you're going to ask before you start your review. Planning your syntheses in advance will help you formulate your search strategy, because you'll have very detailed PCOs that will help you plan a really focused and targeted search strategy. A big one is it ensures that you'll only extract data that will be relevant. When you know what the PCOs for your synthesis are, you're only going to extract the data that you're going to use in your syntheses. And I, for one, am certainly guilty of extracting endless data from a review that will never actually end up in a synthesis. And if only I'd planned my syntheses in advance, I would have taken much less time to extract all my data, because I'd have been really focused. And finally, planning your syntheses, obviously, it helps you formulate plans for your analysis. And it also helps you think about what subgroup analyses you might undertake. I do want to add a final note of caution. Subgroup analyses should be used very sparingly in any review. And what we don't want you to do is to plan and undertake lots of subgroup analyses just because you can, because you've now got the data broken down. We only expect to see a maximum of 3 to 5 subgroup analyses in any Cochrane review. And remember that you also need a decent number of studies in a meta-analysis to be able to subgroup it.